We are here with a special What's Happening interview with Zomi Bloom and Zomi Bloom. I hope I'm saying your name right.
Got it.
And Nancy Christenson. Thank you so much, both of you, for being here this morning. Let me put you both on the air.
Thank you.
Yes.
Thank you so much for having us.
Oh, yes. All right. So we're here to talk mental health, and this came out of a original request. You know, I first got to know Chris Belfield with the Mental Health Task Force years ago. Like, I know it was pre-COVID. And so I was delighted to see his inquiry about this. First, can you just start by talking about how you come to be working where you are, and what's your role in mental health along the North Shore right now?
Nancy, would you like to start?
Sure. I've been a part of North Shore Mental Health probably about 7-8 years, but they originated back in 2022, and it's a group of community members that meets monthly and have Zoom meetings, and we have activities to help promote mental health and help people on a individual base. And we're been doing that, and it's been growing in leaps and bounds.
All right. And how about you, Zomi?
Thank you, Nancy. My name is Zomi Bloom. I work with Wilderness Health, which is a collaborative of 9 hospitals and healthcare systems across northeastern Minnesota, which includes Aspirus Lakeview, which has the Two Harbors Clinic and the Silver Bay Clinic. And part of my work is to help improve access to mental health care across our region and work with community groups. And in 2021, in July, when I joined my role with Wilderness, I heard about this group out of Silver Bay and serving the surrounding region, and got to know some of the members and thought, oh my gosh, this is some grassroots efforts to improve mental health care in our region. I have to get involved. And so I've been working with them ever since, and here to help figure out how we can improve access on a community level and get more people involved in the effort.
All right. Now, I'll just start by saying, mental health has become a bit of a buzzword. You know, we hear it a lot. We read about it in the paper. And, you know, I think it is in danger of becoming kind of something that you start to gloss over because you don't necessarily know exactly what we're talking about here. So do you want to just get very specific with, like, what are some of the needs that you see with mental health? What does it look like? What is mental health? What do mental health concerns look like in Lake County?
Nancy, as a resident of Lake County, would you like to share what you're seeing?
Yeah. Well, I think our biggest hurdle is the stigma that comes with mental health, and that's one of the highest priorities in my eyes of helping, because unlike people that would have some medical procedure or some disease, you know, people come and see them and, you know, bring them food and, you know, just try to help. Where if you know somebody has mental illness, it's kind of more of a standoffish type of thing. And I think we have dealt fairly well with that, and knowing that everybody has some sort of mental illness, whether it be, you know, anything, but we help the adults that are in our communities to just have a networking and know there's some place to go to talk, get help. So
yeah, give us a story of someone that has walked in, or a like what kind of mental health conditions are we talking about, or what kind of people would? I mean, I think stigma is another word that starts to not mean, you know, we start to wonder what it really means. So tell us a story.
I do have one real quickly, if you don't mind.
Wonderful.
We are part of Bay Day celebration up here in Silver Bay, and we always have a booth, our North Shore Mental Health booth, because there's different organizations that are there for informational wise. And so it's kind of a different atmosphere, and so we had a person, David Beard was sitting in the booth this time, and somebody came by and started to basically have, just thoughts about, he said, gee, I'm so glad that you're here. And so it was like, oh, well, thank you, And he goes, no, really, I'm glad you were here because maybe you could help somebody prior to my decline and have somebody to talk to and get information and change a situation. So I was just like, oh, my goodness, you don't know where people are going to communicate and, have a perfect relationship with somebody at the moment, a one-on-one. So that really touched my heart.
Yeah. Do you have anything to add, Zomi?
Thank you, Nancy, for sharing some of those stories and kind of your perspective and living in Lake County. Maybe from a data perspective, what we kind of see across our region is that there are fewer mental health care providers to serve the region compared to what we would see in the rest of Minnesota. There are fewer resources, and we do have quite a bit of stigma that we're seeing. And so when we talk about stigma, we've heard from community members and different listening sessions about things like, I can't talk to anyone about this issue, or it's my fault, or I need to fix this on my own. I heard Nancy say, if somebody's sick, everyone just brings them, meals and takes care of them. Well, if someone goes and has a mental health stay in the hospital, people don't want to talk about that. And that's where that stigma comes in. I mean, can you imagine being really ill enough to go to the hospital and then coming back to your home community? Your family doesn't know what to say to you. You don't know what to do. It can be so lonesome. And so what we're trying to do is have those conversations. And so if you can have those conversations, you can see, you know what? Other people are struggling with this too. And let's surround everyone with community to help people heal.
Yeah, and when you say like someone has there's fewer mental health workers, I'm curious what that means. Like, does it mean fewer counselors or fewer, what are specific titles of mental health workers that people could turn to?
Absolutely, across the board. So there are a variety of different mental health care practitioners that can help you. Some of the providers are psychiatrists or psychiatric nurse practitioners. In the rural areas of Minnesota, we have few to none when it comes to MD psychiatrists. But you know what? That's okay, because we do have some psychiatric nurse practitioners that can help you and some wonderful family practice doctors who can help you too. Your primary care doctor in our region can help with your medicine and help coordinate care. Then there are psychotherapists. So you might have heard of a licensed independent clinical social worker or a psychologist or a licensed counselor. And those people are available to help do therapy. They can do trauma therapy, help you talk through your issues and try and figure out kind of what comes next. So we talk about those kinds of providers everywhere from social workers to therapists to psychiatric and medication providers. We have fewer of those in Lake County compared to the population than we would see across the state. And so that's where you have to be kind of creative. And fortunately, we have wonderful primary care doctors in our region who are helping to kind of bridge that gap. And then where North Shore Mental Health Group comes in is that community approach. So you have someone to talk to figure out how you can navigate your health care.
Meaning someone can call you if they're wondering, do I have a mental health problem?
Absolutely. So people can get involved with the North Shore Mental Health Group. They can email nsmentalhealth@gmail.com or visit the Facebook page. There is also a support group called GLAD, the group for people living with anxiety and depression. I'm wondering, Nancy, what are some of the other ways that you see North Shore Mental Health Group helping at a community level?
Well, the outreach in regards to, we've had meetings in regards to our clubhouse that we've been actively working at to open up in our near future here. And we had people come up from Vale House that in the Minneapolis area that they're very supportive and very are helping us to achieve this goal. And they came up from Minneapolis. And it was January. It was like a snowstorm. Mm-hmm. There was over 50 community members that showed up for this mental health meeting in regards to what a clubhouse really is, how does it work, and just giving people opportunity to ask questions of the experts. And it was so heartwarming to see so many people come out and really, come and come up to the table and ask for more information and that kind of thing.
Yeah.
We've also had Thanksgiving dinners, and we have just like spring dinners. And during COVID, we were putting meals in people's trunks when we couldn't get together. And I've lived in Silver Bay my whole life, so I know so many people, and I'm retired now, but
right. I'm sure that really helps to be well connected yourself.
And it's a whole different avenue. Yes.
Yeah. I mean, one thing that always comes to my mind is that, I hear that one of the hallmarks of mental health issues is loneliness, or it can be. Loneliness is, we hear a lot about loneliness during the pandemic, after the pandemic. And I know that there's just, so many, depending on your preferences and your comforts, there's just so many things to join. Is that something that is a pathway, like when people come to you, or when people express sometimes I think there is the counseling, there is potential medication, and there's, sort of learning to engage and learning to join. Is that relevant, or do you think that's, I'm just, curious what you both think of that. From PTA to churches to soil and water. There's always tree planting. We just did an Earth Day thing. We just did here on the radio, we just did a thing that you could sign up for, a contest with high school, and maybe this is just completely in a whole different ballpark, which you can tell me if it is, but I'm just kind of curious what you think of how much is that able to support people that are suffering? Zomi, how about you?
Oh, absolutely. So sometimes we talk about how, connection is really kind of the antidote to kind of this disconnection, the dysregulation, the illness that we see across our communities. So it really takes, I think, an approach that's comprehensive and holistic. So it's one thing to take medicine and go to counseling, just like you said, and those things can help. And also, if you don't have that piece of connection, that antidote to that loneliness, it's really hard to get better. And so, like you said, planting trees, connecting with nature, going to events in your local community, those things are good for us. They're good for our neurochemicals. They're good for our souls. And I think that where the North Shore Mental Health Group comes in is finding some of those opportunities to help that engagement across communities.
All right. I'm afraid. Go ahead, Nancy.
No, it does take a village for everyone. When I was a greeter at one of our, we had a meal that somebody donated all the proceeds of their lutefisk and dinner during Christmas time. And what happened there is we had a couple of people be at the front location, and so many people just came up one-on-one and started talking, and maybe go down the hall and talk a little bit, but we had a sign-up sheet. Do you want more information? What can we do for you? And so we try to do that outreach in many different areas when you speak of the school, and we have our sheriff's department, and we've got teachers that are on our board, and we have not just group at this point, but it's such a nice group of people that come to our Zoom meetings, and we also meet in person at the United Protestant Church, and we try to be really accommodating of trying to get everybody involved, whether you're in high school, grade school, or a senior citizen, or whatever phase of life that is your current. So
Right. And I'll just add one just fun thing tonight. There's a gospel jam group. They meet at United Church Basement the second Friday. And whether you have an instrument or just like to sing, or even just some people just like to come listen, including people that are, I think, on their own. So just one example of something that takes you can just come and listen or come and join. But I'm afraid we are running out of time. Is there anything I have forgotten to ask either one of you?
Thank you, Katya. We are looking for more engagement and board members.
Okay.
Nancy, do you have anything to add? What would make a great board member?
Oh, I think of a lot of people. We have different needs, and we're just starting up, we are having it like an intern board time that we will have here. And so somebody that is, maybe has some qualities, whatever it be, bookkeeping or community outreach, I was in banking for 40 years, so I have all that background and such. But to be in every aspect of people's lives, and whether you're at church or if you're standing in line for your meal at wherever or whatever, to just be open and aware of what people, might have, and opportunity for people to reach out if they want to.
Yes. So, always good to reach out. A smile is never a bad thing, is it? And a friendly hello.
Yeah.
All right.
Yes.
Anything else from you, Zomi?
No, thank you so much. We really appreciate the time today.
Yeah, you bet. You take care, both of you, and good luck with finding new board members. Always a challenge.
Yeah. Anybody interested, look us up, North Shore Mental Health.
North Shore Mental Health. Great.
Group.
All right.
Thank you so much. Appreciate it.
You bet. Bye-bye. That was Nancy Christenson and Zomi Bloom.